Hi, I'm Greg A. Milliken, and this is my final presentation on adults with type 1 diabetes. According to the American Diabetes Association, as of 2012, 29.1 million Americans have diabetes. Currently, diabetes is the seventh leading cause of death among Americans. Additionally, over $490 billion is spent each year in America due to diabetes. These expenses include medical costs, reduced productivity, and days of work lost due to complications from this disease. Since rates of incidence of diabetes are on the rise, the American Diabetes Association is probably having the most effect in the realm of education and support. Type 1 diabetes occurs at random. No one really knows what causes the onset of type 1 diabetes, which explains the reality of why there's not a cure currently. Type 2 diabetes is a little different. There are some risk factors associated with type 2 diabetes. Those risk factors include obesity, poor nutrition, genetic disposition toward diabetes, and a sedentary lifestyle. All people should work very hard to treat their bodies as homes that will last over 100 years. All persons should work to treat their bodies as an engine driven by exercise, nutritious food, rather than a trash can filled with garbage. The American Diabetes Advocacy Department in Phoenix works with local legislators to ensure citizens of Phoenix with diabetes have rights. Many of those rights include access to safe places to test their blood sugar, especially for children who attend schools that do not have nurses. The ADA Advocacy Department also works with legislators to ensure that health insurance covers diabetes care. I have seen this particular effort personally. My insurance company has adopted a new diabetes initiative, which helps me pay for preventative care and diabetic supplies and treatments. I appreciate this new level of care, which also works to prevent others from developing diabetes. The ADA hosts programs at local schools as well. These programs help students manage their disease and teaches the entire school about diabetes, which decreases discrimination and misunderstanding. The ADA also leads programs such as health fairs and fundraising events that raise awareness of diabetes and encourage the community to support those who are already conflicted with this terrible disease. The state of Arizona is one that respects diabetes care and legislation that protects all those with chronic diseases. The ADA also raises funds that go directly to diabetes research and health disparities and misunderstandings about diabetes and the cause and their care. Locally, the ADA educates legislators, teachers, schools, students, employers, and employees on diabetes care, on the right of those with diabetes. The ADA also has a national program that ensures all students, both K-12 and college students, are protected and informed of their rights when it comes to diabetes care. Education and information is an important element of essential services of public health services. The ADA works locally and, of course, nationally to negotiate legal issues that arise in diabetes care. The goal of this negotiation is empowerment of both employees and employers on the dangers of discrimination and certainly the importance of understanding the very common chronic disease. Litigation is only necessary when rights are violated and the true nature of chronic disease is not respected, especially when it comes to employment. Those with diabetes need to know the ADA will support them and that no job is off limits. Litigation is avoided at all costs, and the ADA supports policy. Finally, legislation is required to ensure the needs of those with diabetes are met. It is not acceptable for diabetes, although it is invisible disability, to be ignored or disrespected. The ADA works hard to ensure those with diabetes are protected by law and employee regulations. The Institute of Medicine outlined 10 essential services of public health. Public health services should serve those adults who have type 1 diabetes and are individual mandates, yet collective in successful implementation. All mandates work together to create a strong public health initiative. It is important for all organizations to collect and share information on community health problems. The American Diabetes Association is one organization that ensures the public is aware of epidemiological information regarding adults with type 1 diabetes. The Center for Disease Control and Prevention, the World Health Organization, and the American Diabetes Association all work to investigate community health problems and hazards, of course. The collection of the epidemiological information helps these organizations keep abreast of current issues. The ADA educates the public on proper diabetes care and sponsors health education programs. The federal government and different organizations such as the CDC and the WHO also provide education programs for the public on the dangers of diabetes. A person wanting more education should also consult local sources on how and where to find assistance. The American Diabetes Association partners with local community resources ensure that type 1 diabetes education reaches the public at large. They provide a local family resource network that hosts health fairs to better educate the public. Legislation is also passed on through community and public health organizations that ensure those conflicted with type 1 diabetes have their legal rights. When it comes to new laws and regulations, the American Diabetes Association is very equipped in the advocacy department. The ADA advocates at both state, local, and national levels to ensure those with diabetes get the proper, deserved treatment and support. The ADA also provides local health services and public health education that is greatly needed by the community affected with type 1 diabetes and type 2 diabetes. It's important for organizations to be confident and evaluate public health needs. Epidemiological information is required for the nation to meet true public health needs. The ADA does gain and research, but most of it comes from the National Institute of Health, which reports on all chronic diseases and public health and the needs of our nation. Everything in this nation should be accessible to everyone, and public health sources such as the ADA ensure that all the needs are met. Science-based research is used to fuel legislation and support for all diseases, such as type 1 diabetes, which helps make our nation a leader in support for treatment of chronic diseases. I would like to thank you very much for your interest and participation today in type 1 diabetes for adults.